and to have an agency just in this area to be able to address some of the needs of the uncertainties when you see a child do things that you just don't understand.
Our mission is to lead autism services, support and services through all stages of life, where they've come and had the chance to try something new, something that they're not sure if they can do it or not, but do it knowing that they're in an environment where they're supported.
We try and make sure we can see where they're at and direct them back to the resources that could bring them to the next step.
Welcome back to Finding Common Ground with Heather and Steve. Today we're going to talk about different resources and services and supports that you can seek for your loved one that has autism or another developmental difference. We have different guests today that come from Kelberman, which is an organization in the center of our state. They serve over 1,000 families, and it's about a 6-county radius that they serve. And Steve holds them in really high regard. When we launched this podcast, he was definitely sure that you guys were going to be one of our guests, right? He thinks a lot about you guys. And even though there are dozens of organizations and agencies probably in his region, Steve, what makes them stand out? I mean, even if our listeners aren't from Central New York and maybe Kelberman doesn't serve their region, I still think this is an important show for them to tune into. What makes Kelberman unique?
I'll give you a story. One of them is my son. He's 34 years old. He had all kinds of things going on with him that we weren't sure what was going on. And back then, they weren't diagnosing autism way back. So I had no idea. And one of the reasons why I really wanted Kelberman to come on is for those families going forward, because I didn't have there wasn't a Kelberman to help us back then. I had to learn the hard way. And to have an agency just in this area to be able to address some of the needs of the uncertainties when you see a child do things that you just don't understand is why I'm so glad to have our 3 guests here from Kelberman today.
I agree, because I think that a lot of times families, you're struggling through that first part of the process, right? Like, oh, we're going to have a diagnosis, and then they're going to evaluate us and look at us. And I know a lot of parents feel like they don't even know what to ask for. So I'm hoping, like, as we listen to this episode, we hear about Kelberman and why they started and what they aim to do and what they're looking for to doing into the future as well, because this is such a changing landscape for different families. But I can think back to the beginning of my journey. And as a psychologist, I had helped hundreds of families go through the evaluation process and the diagnosis process. I was part of their home-based team that would come to their home. But then when my own child got a diagnosis, it's such a shift when you're no longer the professional and you're the parent. And now it's your baby, that you have to look at differently. So I'm really looking forward to this conversation, because I know there's a lot of people in that part of their journey, the beginning. But there's also people who are already in the middle of it, right? And they have some services, and maybe they feel like they don't have exactly what they need. And I'm hoping they'll tune in and they'll hear what you guys offer. And even if you don't service their region, they'll know what to ask for when they're advocating for their own child. So I'm looking forward to each part of this conversation. So thank you so much for coming today.
Thanks for having us. I'm Kelly Carinci. I'm the Chief Development Officer. I've been with Kelberman. It's going to be my almost 5th year. And Heather, just what you're saying, when you talk about a journey, that's really what we're there for. Our tagline, we like to say, is our journey together. And it doesn't matter. Our CEO often says, too, we're your true north. Wherever you are on your journey, you can find Kelberman, and we can help you along the way. And when Steve talks about Kelberman, how special it is, I feel it too as a staff member for the last 5 years. It's just inspiring working with people who really want to do the best for the people we support and the families. And everything we do each and every day is focused around that. So, and the story, how Kelberman started, is really, it starts where, our hearts begin. Michael Kelberman, Dr. Michael Kelberman, is a cardiologist in our area. He's from the Utica area and went to school in other areas. And how he came back to the area was his son was diagnosed at 3 years old. He's in his early 20s now, and there weren't any services available. Now, if you look where we are, if you go to bigger cities, there's, different opportunities. If you're in Boston or even Albany or even Syracuse and Rochester, where we are, we're very rural. And it's hard to find sometimes the support and services you need. So Dr. Kelberman started Kelberman in 2005 with $500,000. And when you talk about a true nonprofit and what that means to help others, he started Kelberman to be there for our community. So if you have families who need support and they can't get to Binghamton or Syracuse, you could have support and services right here in the area where you live. And we've expanded from then. But when we talk about a true nonprofit and what we do, we are grassroots. Dr. Kelberman still is our board president and founder. He lives with his family in the area and has never left because of this vision and what he wanted to, it was a calling. Not only, I say all the time, not only does Dr. Kelberman fix heart at work, but outside of work as well.
Oh, I love that.
So we have, our mission is to lead autism services, support and services through all stages of life. So exactly what you said, Heather, it really resonated with me, because wherever you are on your journey, you can call on Kelberman to help find what your family needs or what you need support when, if there's anything going on.
Because there's so many different things that pop up. It's not just making sure that your insurance covers the prescription. It's just not, there's so many more pieces to this puzzle. And families sometimes reach out to other families. And I think that was one of the things that Steve had said to me that really resonated with me beforehand, that everyone told him, this is the place to go. These are the people who understand. And as a mom and a professional, that's what you want. You want to know that you're talking to people who care. And it's not just about processing another person, that you're not just a number. Because sometimes with those really big organizations, that's the feel, right? It's very clinical. They're not family-based. They're really pulling your child. They're working with just them. And it feels like that this is more of a family model, and it really supports to wrap everybody up and make them feel supported. And I think that if you're in an area of the state or across the country and you're not feeling that with the agency that you have, listen to what they're saying, because you could push for something like that in your region. Dr. Kelberman started this nonprofit, and Steve and I will say this all the time. It's really the families that initiate some of the things that matter. So if you feel inspired, maybe it's not just modifying what's already in your area, but it's maybe you're listening and you think, I could do that, or I could start something like that near my home.
One of the important things that we really moved forward with, from 2005 is not just the services, but how can we push into the community and really bring a community together? We do so many things to help families make sure that they aren't ever alone or feel alone. And it's just, like I said, it's really a calling to serve, servant leadership for most of the people that work at Kelberman. We have these brilliant minds, but you're really called to serve and to assist families each day. And that's the thing, when you talk about stories, Bethany and Maria and I will all be able to share many of those, where we'll have a mom say, I was devastated when my doctor told me the evaluation or what I needed to do. I can't imagine how my life moves forward. And we have so many stories of how Kelberman can support what your life is and it's going to be. And it's wonderful, especially with a community that supports you and we're all accepting.
And Steve, you were telling me about a community event. I don't know if it was walking or bicycles or maybe both. So I apologize. I think it was both. I think they're two different events, but Tell the audience a
think
little
I'll-
bit about that, because I mean, that
Yeah.
brings families together. Besides just supporting one family alone, you're making a community where you feel like there's other people on the same path.
Right. Look,
Sure.
I think I'll have Beth talk on that, but what I will say about that, Heather, is the fact that when you go to these events, you're going to see Maria, Kelly, Beth there, and even Dr. Kelberman. One of the events I'm sure Beth is going to talk about is the Pedal for Autism. Dr. Kelberman rides in that.
I love
think
that.
it's so important because he's getting involved with the people he's asking for support and the donors and everybody else, and he's right out there in the thick of it. So, Beth, your turn.
Yes, thank you. So I will introduce myself. My name is Bethany Wendt. I am the Director of Community Relations here at Kelberman. So I will start by talking about some of the community events and things that we do in that regard. And I love to say that I get to do this job because I really believe it's an honor to be able to work with the community the way that we do. And really provide the supports and services that we're able to for our families. Some of the wonderful things that I, as I said, get to do is work with community businesses and organizations and talk about ways that they can be inclusive and establish different processes, or maybe change the environment in a certain way to make it a little bit more accommodating for the people we support. So we've done a lot. I've been with the agency a little bit over 2 years, and I can't believe just how much we've accomplished. But one story, and I know you said you like to hear stories that resonates with me, is we work and have worked with Woods Valley Ski Resort. We do our pedal there, but we also do a tubing event there. For the last 2 years, we reserved the entire hill for Kelberman families, and we established an accommodation where we only give away half of the tickets of their capacity to make it so there are not a lot of long lines. It's a less chaotic environment, things like that. We also work with the staff beforehand, talk to them about what is autism, what might it look like, how do you be helpful to a family, how do you make them feel welcome here. So we've done that for the last couple of years, and I always am looking for feedback from families on how these events are going, anything we can do differently. And one mom reached out to me and said, "Thank you so much for doing these, because without you doing these events, without you doing this tubing event, I would never be able to do this successfully with my child." And we've had those experiences where they've come and had the chance to try something new, something that they're not sure if they can do it or not, but do it knowing that they're in an environment where they're supported. People are around that want to help if they need to. And if it works, wonderful. If it doesn't work, that's okay too. But at least you've had the opportunity to learn what you can do and what opportunities are out there for you to experience.
And it's a safe place. As a family, I just can't express how much that means, because we can try different things. I have 4 children and they have varying levels of disability. And our most involved medically complex daughter, she wants to try new things. She wants to, but then I bring her and it's not set up for her, right? And she could have a seizure, or she could have, a meltdown. And then she says, "I can't do that again." And I think, no, we can't do it like that. But there has to be a way we can make that work for you. Like, let's not go to the mall on Black Friday. That's silly. But maybe we can go on a different day when it's not busy, go on a day during the middle of the day when everybody else is at work or at school. Because I think we have to be creative as parents, but having an organization that's doing that for you. I mean, I've had parents come up to me and say, "I just want to bring them to church. And I don't want to have to stay in the back room closed off from everybody else. I want to be able to hear the sermon live. I don't want to watch the recording on the little screen." Or people people who say, I just want to go to the movie theater, just these normal everyday things that other families might take for granted, that their kids can get through those moments, but ours make noises, or they move around, or they ask lots of questions really loudly. That's my one son. He's a loud talker. So it makes me so happy that there are people doing those things. So if you're listening and you can say, what sensory friendly event could we pull off in our community? What kind of things, what organizations are really open to it? We talked to Vin Scalise from Utica Center for Development. That episode was recently released, and he was very open. So you can reach out to veterans too. It doesn't always have to be special needs, right? So that's really great.
Absolutely. Yes. And, to speak a little bit more to that, we have been welcomed with open arms by a lot of our community partners, and being one of them. Steve, you've connected them with us, and they've helped us with transportation to these events. So there's many ways to think creatively to get everybody involved. And the ultimate goal is not to have just one Kelberman Day. Why can't we do this once a week, once a month, maybe, whatever is needed for the community? We're there to be an example of what a business can do or an organization can do regularly, not just once a year.
That's beautiful. And that's the mindset we need, right? We need to know that we can fit in somewhere and not feel like we have to mask. That's one of, I worked with this gentleman 20 years ago, and now we're friends. He lives in a different state, and we talk all the time on the phone, and he was diagnosed with Asperger's. I know that's not what we say anymore, but he'll tell me, when we were in high school, I felt like we were being taught to mask our autism, to hide it, so people didn't know that we had it. And he said, it took me years to get over that. And I thought, oh my gosh, I was one of the people supporting him. And I felt so horrible to hear that that's how he felt, that he couldn't be himself. And I know we have to teach people appropriate behavior and what's socially acceptable. And you don't want people to be rude, and you want them to have manners. But we don't want them to feel like they have to be somebody else to have friends, or somebody else to be able to go out into public. And we feel so isolated as families. Even when I went to the sleep clinic to figure out why my daughter could not sleep more than 90 minutes in a row, they kicked us out. They said she was too loud and she was waking up the other people who were there. And I thought, you're the ones that are supposed to help me figure it out. And now I'm leaving in the middle of the night, So I really appreciate the mission that you guys have and the sincerity that you have with it. Because a lot of people say words, you read their mission statement, you're like, that's really nice, but you're doing it. And I can tell that's why Steve holds you guys in such high regards, because he sees it. And he's had so many examples in his house. I mean, how many different kinds of kids have Kelberman helped, Steve, that have come through your house?
We're a therapeutic foster home. So what happens is a lot of the kids, they could be 5 years old. They could be 12, 14. They come in and we see signs of what we think might be autism. And so we have to get an evaluation. And the first thing we do is try and get their pediatric doctor to get us a referral to Kelberman. And we've had kids that go through those evaluations. And look, my kids are in front of a lot of doctors. And I have to throw this out there. Dr. Dempsey and Dr. DeRose are fantastic with our kids. When you take a kid that's nonverbal, you take a kid that's got massive behaviors that we see and bring them into your guys' offices and their offices, you don't know what to expect. And to get through those evaluations, because they can be tough and they're analyzing and everything else, and to have the patience to do it, I'm just not a fan of these three young women. I'm a fan of a lot of their staff, including, like I said, both doctors.
That's so nice. That has to make you guys feel good, right? I mean, we've all had jobs that we're like, not, nothing to write home about. But when you have the one where you're like, this is really a calling, like you said, and I get to be with other people who care, that culture that you guys have cultivated, that's something to be really proud of. Because in an industry with Medicaid as a funder and billing and cutbacks and grants that don't come through. It's a hard job. It's a hard business to be in. Is there any advice that you would give to families or organizations that are starting out to somehow cultivate what you guys have captured, because it's special?
Yes, I'm Maria Cappoletti. I am the Chief Executive Officer at Kelberman. I appreciate, you recognizing that and, kind of highlighting that, because I do think what we are, how we provide the services and how we outreach and how we care differentiates us. And Steve, I'm just as proud and fond of our team as you are. I think what we try and do, as you said, Heather, there are so many roadblocks, right? There are so many doors that close. There are so many bureaucratic kind of red tape and wait lists and all the things, some things that we just don't have control over, right? But within that, there has to be a safe place. There has to be a soft landing. There has to be that connection and understanding. And I think that's what we try and do that maybe sets us a little bit apart in terms of that environment that feels welcoming. I think what we like to try and promote, and what I like to say to our team is, we are creating a community of understanding, a community of belonging within our larger community. Right. And that's where we get to becomes more of the norm. The more that we're there and the larger community can see and understand. And we, as Bethany's saying, creating those partnerships and those sorts of things, in our opinion, those are the things that really have just as much, if not more impact than, the medical needs and the appointments and all the things that we need and the Medicaid services and all of those things and services that we offer absolutely are important. And we continue to do those in the best quality way as well. But I do think this fabric that we try and weave as that support network and that, as Kelly said, I like to say our true north, for families to say, okay, I have a question now. I didn't have it when my child was 5. I didn't have it when they were 6 or 10, and now they're 15. But you can come back, right? And we may not always know the answers, but we're going to walk alongside you, like, Kelly was saying, helping you navigate that in a place where you can trust. And I think that for families is what we hope to offer as, really something that kind of sets us apart in that feeling of understanding, trust, and we can count on an organization or a person or picking up that phone, and you're going to get that connection. I think that's what we hope to do as an organization.
I'm sorry. I was just going to say, does that come down to like professional development or training or team building? Because there are hundreds and hundreds of nonprofits in our state, in New York. I mean, we just have around every corner, but they're not all built the same. So when you capture that, it's just like I just wondering if you can dig in a little bit about, do you debrief? Because sometimes a family comes in and the situation that they're facing is different. It's just something that you haven't had to straddle before, right? You're like, wow, I've never had somebody in this system, if you're in foster care and, I can't access all of the OPWDD stuff because they're in foster care, which that doesn't really make sense to me, right? And they have a mental health condition. And goodness, now they have a medical issue. They have diabetes or something. You think this poor family has all these different complexities with different systems. And as an organization, you have to understand all those different systems, even if they're not yours, even if it's not your funding stream, you still have to say, you know what, you could talk to Social Security, or maybe this place can help you with guardianship, or whatever the case is, because there's all these different moving parts. How do you stay up to date? Because it seems like for your families, you guys, even if you don't know the answer, you know where to send them. And that's another real talent too, to stay on top of all the different regulations and policies.
Yeah, it is. It definitely is. And I think that is another area of focus of the organization. And Bethany can speak more to this because kind of tasked her in this area. in community relations and outreach, and we have what we call our family navigation, right? Helping people, families, caregivers navigate exactly what you just said, right? And it is very complex, and the different systems don't all work together, right? They're siloed, and but the people in lives and individuals aren't siloed, and they're complicated, and all the things need to interweave, right? So we try and really focus on that in our family navigation and outreach, and really have dedicated professionals that have that knowledge and background, and connect them to like their care coordination organization if they do not have a care manager or care coordination organization, because that's the fabric that we need to know and understand when you're looking at the system as a whole and a person as a whole, right? So we try and make sure we can see where they're at and direct them back to the resources that could bring them to the next step. And then help them kind of connect the pieces of the puzzle. And as we were saying earlier, that's going to always change, right? Things are going to come a little bit more priority than others at different phases in life. And we try and also collaborate and communicate with the other organizations and professionals to weave that collaborative approach, even if it's not our own services or our own, right? But reaching out and saying, okay, I know they can help there, and creating those relationships as professionals. So we also try and do that. And, Bethany's the key in her team in helping with that kind of really approach and kind of walking alongside families and individuals as well.
Family navigation is a wonderful service. And I know that there's other organizations that offer that. And I don't know if it's an actual title that you had to it means something consistently across the state. But that's something our audience can say if they're calling an organization, do you have a family navigator, somebody who can help me with that piece? So thank you for mentioning that title, because I've heard it before. I work at Autism Up, and we have family navigation as well, connected with the hospital in our area, U of R. So definitely.
Yeah, absolutely. And I think there are some organizations that have that same title or similar things, that help. You asked me a question earlier, and I want to maybe respond to it a little bit. What's different than, here in Kelberman? And I will say it's the people that we, try and bring into our organization and hire and have that same mindset. I came to Kelberman just a little over 2 years ago. I started in the operations role. I've only been the CEO at Kelberman for 2 years now, at the end of this year. But I have a long history in intellectual and developmental disability services as a professional. I've been in the field for over 30 years. I started as a music therapist. I focused in autism services. And my career has always stayed in that field. But my adulthood brought me to also being a parent of a 24-year-old now young man with autism. So, I think that experience and perception, things like concepts of presuming competence and having a person-centered approach and having the connectivity, as we talked about before, and understanding the complications, but also meshing that with the kind of warm handoff in communication. Those are skills and values that are very important to us as an organization. And I think that we can say that, as Steve was saying, whether it's Dr. Dempsey or Dr. DeRosa or Bethany Wendt or Carinci or all the other staff that we have, it's something that we want to foster. And you said, is that training? Is that development? It's all of the above, right? And we certainly have a lot more to do and a lot more ideas and more that we want to accomplish in that area. But I do think it's a culture and a mindset that always needs to come to the forefront. We just had a staff meeting this week, and I said, there's always going to be bad days. We're always going to get frustrated, whether it's, things you become complicated, whether, it's just, whatever it could be, that you can't predict in a day, or that you wish you could move a mountain that you can't. But even our employees, it's always important to step back and always remember, why are we doing what we're doing? And it's to serve. It is to be there for the people that we support: children, teens, adults, families, caregivers. And I think that's the important part that we want to use as the fabric of us kind of operating every day. And I hope that's what all families can feel whenever they go to any of the organizations. Because let's face it, as a parent, you get the diagnosis and your life changes. Whatever that change means, you don't know what's ahead, right? And every day and every year is going to be something different. And most people's human nature is you don't want help. You don't want to have to ask for help. You don't want to be in a situation to need help or to not know, to be in an unknown situation under our uncharted waters. And all those things are uncomfortable feelings that nobody wants to be in. And, for us, I think the most important thing is to always make a person, a family feel comfortable and say, it's okay. We are going to walk alongside you. It's okay. We all don't know all of the answers all the time, but whatever we do know and whatever we can help you with, we're going to be here for you. And I hope that goes farther and longer than the frustration when there is a wait list that we don't want to have either, but we're managing staffing and all of that. So if we can do that, to kind of just be there in sincerity and understanding what they're navigating. I hope that is what we can bring to, the families that we do have the privilege to enter their lives and support them and walk alongside whatever they may need.
That's empowerment, right? Not only are you standing with them, but you're empowering them with the knowledge that they need. And then when I'm not here, you'll still have that knowledge. Where a lot of organizations, and especially the medical model, there's almost pity, and I can't handle it when somebody says, I'm so sorry about your daughter. Like if they find out she has seizures, and I think, don't be sorry about my daughter. Like, don't be sorry about her. She's wonderful. She is a true blessing to our family. And is she complicated? Sometimes, right? But don't feel sorry for us. Empower us. I had one woman, we were in the hospital right after she had 5 seizures in a row. She was on a ventilator. I was just beside myself. I was one of those people that said, I can handle anything but seizures. And then she started having them, right? So I'm sitting there and I'm trying to collect myself. I'm trying to figure out what my next step will be. And I said to a nurse, do you think it's what she's eating? Do you think she's just sensitive to some things? And the doctor immediately was like, no. He walks out of the room. And she looks at me and she said, Mama, if you think it's something that she's eating, explore it. There's this woman you can call, and she gives me this number. Now, this woman was living in China at the time. She was an American, but living there. And she told me all about the modified Atkins diet, which was making your food more pure and whole foods and lowering the carb content and more protein. It has changed my daughter's life. I didn't just listen to one no. I felt empowered to explore things and try different ideas. And if that's what you do for families, thank you, because we get so many, nope, your child will never walk, your child will never talk, your child will never do this. Don't expect college. Don't, like all the dreams that we have, it feels like somebody just throws them out right in front of us. And then they don't know why we're upset, and it's just such a different perspective that you're offering. And I think part of it is you're a mom too, but I can see it in all of you. I can feel it from you. So I'm really grateful that Kelberman is there. I don't know, Steve, if you have, as we're wrapping up, if there's any story or something that you feel like would really pull this all together for our audience, but I would love to hear
One of the reasons why I like their management team at Kelberman is because it starts at the top. I think I'm involved with a lot of agencies, Heather, you know that. I think any kind of leadership, it has to be somebody at the top. And what's cool about Kelberman is I can't begin to tell you how many times I've come to these girls' offices with harebrained ideas, trying to find a solution to something that I think is an issue with kids that are in my home or kids that I see or kids that I might advocate for. And they always have their ears open for me. And there's not been a single time that they've not listened to me. And I think that's important as a parent, not just as an advocate, but as a parent, that somebody's listening to what we're trying to tell them. And then and they do go out of their way to make things happen. And like I said, I'm a big fan, and they know that I tell them all the time. And there's a reason. It's because they live what they say, and they
That's
do as
great.
they say.
Well,
Now-
we appreciate that, Steve. And I will just say that it's families like Steve and others that, continue to keep us on target and help us know, are we on the right path and getting the feedback? Because as you said, Heather, you have families are constantly hearing the word no. It's no to everything. It's, nope, they're not going to accomplish this. Nope, not going to accomplish that. So it's important to communicate together and say, what are you thinking? What are the things that we can move forward and do together? And so I think having families is also what makes us strong. Families that are involved, families that help us every day. It's not just us. There are many times Steve and his family's been at the pedal and volunteering, at the walks and many other families that are there supporting us. We wouldn't be able to do what we do, and we appreciate the feedback and the positive, response to that, but it is because they're doing it with us. And we always have to bring the families along because that's why we're here. We need to do it together.
Absolutely. To close out the show, I have an idea. I don't know if it's going to make sense. Let's see how it goes. But I would love to hear what you guys think are the hot topics for families right now. Steve and I are filling up our calendar for next year. We're lining up guests. We're thinking about what content families need the most. You serve over 1,000 families, so you know what the pressing issues are. What would you say if you each took a turn would be something that we should focus on a future episode, or something that families are really struggling with at this time?
Well, that's a tough one, Heather. The list might be long, but I'm sure, and then we've had these conversations, right, Steve? I think meeting unmet needs, and those unmet needs are a long list, right? Whether it be medical, behavioral, dental, the services, all of that. There are a lot of unmet needs. We talked earlier about the siloing and, kind of the hoops that you have to jump through. The wait lists, right? It's very difficult. The wait list, the lack of being staffing that to attract the expertise into jobs to be able to reduce the wait list, the lack of staffing for direct support professionals, right, and being able to find staffing. So I think those are things that are frustrating for families and equally frustrating at times for providers, right, trying to figure out a way to navigate those roadblocks and think about different ways to move forward and have the system as a whole work better.
I'll go next. Now, Maria and Bethany have so much knowledge and have been in the field for so long. With my role, I started at Kelberman at doing fundraising and communication, and I've taken this journey with our families, and I just love all of them so much. And there's so many times that people reach out to me and I really have no answers for them. But I've taken the time to listen and that, Kelly, thank you so much for helping me. And I really haven't done anything but listen. And what I have come to find out is that agencies cannot, and organizations that want to be there to help people need to do just that, listen. Sometimes it's not finding the answers. It's just listening and understanding, like you were saying, Heather. And I hope moving forward, more organizations will take time to really comfort, when people need that, no matter what it is. So more community, more listening, and more servant leadership, I think.
And I'll
Anything
go
you want to
last.
add? You're in the hot seat.
No, that's okay. Maria did a fantastic job touching on those, really pressing things that have, unfortunately, in some cases been chronic issues just for the system in general. But I think finding organizations that have a perception that's similar or a perspective, I would say, that's similar to Kelberman's, and that if there is a barrier, that does not mean we stop. It means we get creative about how we work around that for families. And as Kelly said, we listen. We had an event and one of the speakers said some really nice things about us at Kelberman. And one of the things that they said is that we extend a hand to families and say, come along with us. We will help you. We will be there for you. And I really believe that we do that. Our family navigation service, I know we didn't get the chance to really dive into our menu of services, and we have quite a lot to offer to the community. Clinical services, home and community-based waiver services, residential services, our educational services with our Promise preschool, a wide array. So how do you find out about that? Reach out to Family Navigation. And I know other agencies have Family Navigation, but Kelberman is near and dear to me. I really believe that if we don't have the answer, we do not let you go without something. We let you come to us and we say, okay, I may not have experience with this, but let me reach out to some of my contacts and make sure you get connected. We don't let you leave without at least something. And I think that's what makes us special. We're truly in this business for people. We really are.
That is such a nice way to wrap up the show. We usually do some kind of call to action at the end. I really want our audience to explore your website, and we'll put the link in the podcast description so they can find it. Obviously, if you guys have questions for these wonderful women and you want to reach out to them, I encourage you to do that. I know from what Steve has said and what we've all said this whole show that you would be very open to that part of it. The piece that I can also say is speak to your legislators right now, your policymakers. New York State's coming up with their budget. Every state is. And we need to be a priority. I mean, early intervention is struggling. They didn't get their rate increase that they were promised. There are little kids that 10 years ago would have had a full program wrapped around them. We would have had support at home, and they would have had a preschool option, right? Something in a structured setting in the community. And lots of kids are home right now, and they're not getting those kind of services. And it's not because Kelberman and all the other organizations don't want to offer it. If the funding isn't there, it makes it really hard to hire new staff. It makes it really hard to get the new piece of equipment or to rent a bigger building. So I want our families to realize that it's not an organization in the way as much as the funding streams and the policies and being a priority. So just calling your legislator, your assemblyman, or your senator and telling them what your life is like, telling them that you're worried about the future, because we will save money spending a little bit up front, right? We know what happens when people come to your home and your child gets to have these structured therapeutic interventions. You might not even know there was an issue later in life because it will be solved, right? They'll have the coping strategies, they'll have the skills, they'll have the network of people who they can count on. So as families, that's something that we can do, and that's also empowering. Make the phone call, set up the meeting, knock on that door and tell them what our reality is, because I don't think enough of them know what we're going through. And that's a main goal for Steve and I with this show, is just to really shed light on the topics that a lot of families are feeling and living, and to give them really actionable ideas about what to do next. So thank you so much for coming today. It was a pleasure learning more about Kelberman. I look forward to chances to collaborate with you, and maybe we need to do some crossover event with Autism Up, because it sounds like we are very similar, and I would love to have more discussions in the future to see if we could do some kind of something that would serve all of the families on this side of the state, right? That would be fun. So thanks again, and I hope everybody has a nice day. Until next time.
Thank you.
Continue the conversation by joining our Facebook group. If you're a fan of the show, please join our supporters club. Subscribe on YouTube, rate and review on your favorite listening app, but most of all, share it with your friends. Just one more click or comment can make a huge difference and help us to continue finding common ground.